Good afternoon, viewers. Welcome to this important teleconference on psychological intervention for adolescents problems, with a special reference to students or adolescents with disability. So, see, this adolescence problem is, I think, everybody must have must face any time, or a time when it is to be faced by a adolescent or teenagers. And then it seems that these are the problems which is sometimes disturb the adolescents. So, but it is to some extent it is natural, because when the transition period take place, there are so many things which happens which cannot be considered as problems, rather we consider it as a problem and people consider it as a problem. So whether these could be a problem, these are hampering the mental health of adolescents or not, particularly of adolescents with disabilities. So these are so many issues which could be known by everybody. And for this teleconference has organized, and for to talk in detail on this specific issue, we have Professor S.P.K. Jaina from Delhi University. He is a professor of applied psychology in Delhi University. Beside this, he is a well-known clinical psychologist and vast experience in the dealing with the psychological problems as well as psychological interventions of public in general, and adolescents or persons with disability in particular. So I welcome you, Professor Jaina,
Thank
to
you.
this teleconference, and I request you to please talk about this psychological intervention as well as psychological problems at adolescents in detail, please. Thank you.
Hello, viewers. Adolescence problems are very prominent. People believe that adolescence is a period of unrest. During the period of adolescence, people experience a lot of problems, and these problems are found to be much more conspicuous, much more intense when people suffer from disabilities. When we say people with disabilities, they do have normal course of development in many areas. But there are certain areas in which the development is affected. We do not say that the development is affected in every area, but there are some special areas in which their development is affected. So we have to focus on those areas in which they have problems, they have difficulties. Now, when we discuss about the disability, when we discuss about the problems of people with disabilities during adolescence, we have to remember one thing, that during this period, we have to look at disability from a broader angle. We have to look at the broader aspect of development. Development, as you know, which occurs, it is an interactive process. Not only that the child develops, but also with the child, with the individual, there is a development of the world around the child. The parents, the relationship between the family members, the environment in which he grows, everything develops along with the child. If the child with disability has a problem, it has a ripple effect on people who are around the child. That is why when we identify any problem with people with disabilities, we have to identify the difficulties which are faced by the parents, by other people who are called the caregivers who live with the child. That is why the problem is not just a unitary problem. There are a number of developmental theories which speak about the interactive aspect of development. There is a lot of interaction between the child and the environment, and that is to be taken into account when we talk about the developmental aspects. What is most important in the development is basically the kind of the development of their what you call the self-concept. During this period, the self-concept develops, and the child tries to adjust with the changing concept of self. And when we say that the development is self-concept, self-concept is not just one aspect of the development. Self-concept develops because of their social experiences, their individual experiences, and their experiences with the jobs they hold, the kind of activities in which they are engaged. So this is one aspect which we have to focus when we talk about the development. and people who are around them are important while considering their problems. If you look at the child's development, the adolescent development, you find a lot of different kinds of problems they experience. Some group of problems are the problems which they experience throughout their lifespan. Throughout their life, they experience the problems of self-care, the problems of hygiene, the problems of grooming, expressive language, mobility, and all these problems which are pre-existing with the individual. But apart from these problems which they experience throughout their development, there are special problems such as the problems of autonomy, socialization, the problems of gender-related issues, the problems of emotional behavior, and also the problem of employment, which comes at a later stage of life. Now, the issue is that which problem we are going to deal with in what manner, in which manner. And before we go for any kind of intervention, there is a need for scientific approach to intervention. We need to understand the extent of the problem. And while doing so, we have to understand the extent of the skills they have, the assets, the behavioral assets they have, and the problematic behaviors they are experiencing. So these are the two sides of the same coin. Many times, when you talk about development, when we look at the developmental problems, many times we do not look at the behavioral assets. Many children do have behavioral assets. They have good socialization skills. Some people have good mobility skills who are not otherwise affected. And there are many other skills which you can hinge upon to make the development a kind of holistic process. Some of the developmentalists, some of the the therapists are much more focused on the problems they experience. They are so much focused on the problem behavior that they forget about their normal development. They forget about the assets they have, behavioral assets they have. That is why there is a need for assessment, and this assessment has to be very balanced. There are two types of assessment we talk about. One is the normative assessment. How do your child behave compared to other children in your community? Normative assessment. We use standardized tests for the assessment, don't you? And another group of assessment is the criterion reference tests. And these tests are used to find out what is the level of skill development so that we can promote the development. What is the level of deficits a child has, we can identify by giving specific tasks so that the individual can be mapped out. We can map out where the child exists, and accordingly we can design various kinds of intervention programs. And this is very, very important aspect of the development. We cannot have a quick fix to the programs, the problems they have. We have to design a program, individualized training program, to find out where the child is standing. What is the current situation and what exactly the child is experiencing and what difficulty is finding. That is why we try to use some kind of experimental designs, quasi-experimental designs to study in a very scientific manner. It involves the scientific skill of a scientist as well as the skill of an artist to understand the behavioral problems, the kind of difficulty the child experience in the day-to-day life. So that is why assessment is a very important issue. As I told you that we are not only focused on the problems, we are also trying to see the general development of the child, the overall development of the child. And if you're looking at the overall development of the child, we are trying to look into the growth-oriented approach, the general growth of the individual. And in order to do that, you may have to use different kind of approaches to do that. You can have a direct approach or you can have an indirect approach. Direct approach is the approach which is focused on the disability itself, the difficulties which the child is finding. Indirect approach is one in which you try to develop the skills, available skills which are already existing with the individual. And this generic approach is focused on the development of the sense of self, construction of the peer networking, and enhancement of the agentic aspect of the behavior of the individual. When you talk about the sense of self, we try to see that the individual self, the self of the individual, the self-image of the individual grows, develops during the training program. So development of the self is very important, which is a meaning-making process. Every individual realizes his potentials, his growth, his self-concept by performing certain activities. And more a person can perform successfully any activity, better is his self-concept. The individual with disabilities sometimes find it difficult to realize their skills, and they have poor self-concepts. Higher the level, deeper the level of disability, higher is the distress, and people feel that they are not able to realize their potentials. That is why there is a need for developing skills in different areas. This is experienced sometimes in the form of being able to take responsibility, perform different kind of developmental activities, riding a bicycle, doing some kind of activities at home. And if a person is engaged in these activities, then he feels that probably he's capable of doing something. He's empowered, he's capable of doing this, doing these activities. That is why you need to focus on many of these developmental skills apart from focusing on the problem behaviors. So what is most important is that the degree of disability, because of the degree of disability, many people will not be able to perform certain activities adequately. They need prosthesis. They need some kind of appliances, some kind of help so that they can perform them well. So developmental skills have to be focused when you try to discuss, when you try to intervene in problem behaviors. So this is an alternative approach, the generic and alternative approach. And this approach is much more beneficial than if you are working with specific kind of difficulties which a child experiences. So this is just to remind you that human development should be holistic. That is why if a person gets rid of his problematic behavior, doesn't mean that he is healthy. So the development has to be balanced. The next issue which we come across is the developing peer network. Young people enjoy being with peers, but because of the lack of connectedness, because of lack of interaction and socialization, many children fail to benefit from the social interaction which they can have with their peers. For instance, social skills fail to develop adequately because they do not have good peer relationship. They do not have peer circles to interact. And peers are the ones who act as reinforcers for certain behaviors, and these behaviors get strengthened if they are reinforced in day-to-day life. That is why peers are so important. They learn to resolve their conflicts, they learn to develop some kind of trust, they learn to develop intimacy. These are some of the basics of social skills. That is why peer relations is important. We request the parents to help the child to interact, to socialize himself or herself in peer groups. Sometimes we arrange such situations where the child can interact well with the peers, and this peer interaction becomes wonderful experience for the child, and gradually the social skills develop through these kind of interactions. And these interactions has to be programmed by the parents. Programmed means it should be pre-arranged so that the child can look at specific social cues and would be in a position to identify those cues and benefit out of those. They need feedback to develop social skills. And there should be someone, maybe professional, maybe a parent, maybe a teacher, to be there to help the child to pick up those social skills, those social cues, to communicate well with other individuals. And that forms the basis for future interaction with the world around him, with the adults, with people around him. That is why intimacy, trust, and conflict resolution are the three important areas on which one can focus when you try to develop skills in the children. So nowadays we talk a lot about networking. A child, when he is very young, he has very few people to interact. When he grows older, there is a larger world around him to interact. And how to interact has to be taught to the child. And when we teach these children, they develop better skills. That is what is most important in developing networking with people around them. Because the social world is very important for, for everybody to sustain skills in the natural environment. These skills may develop. A person may develop certain skills like feeding himself, eating, feeding, and moving. This kind of mobility skills should be sustained in the natural environment. And that is how the social skills come into play. The parents should sustain these kind of behaviors in the natural environment. So how to improve these skills? While looking into these skills, when we try to develop these skills, one has to identify the appropriate cues. Cues help a lot to develop these skills. The person perception plays a very important role, and what are the appropriate skills one has to identify. Perspective taking is also important. How certain things look at from others' angle is important. How things appear from others' angle is important to understand, to empathize, to interact with other people. And that is how you understand the emotions of others, how people feel in certain situation. Some people feel sad, some people feel happy, some people feel angry in certain situations. The theory of mind talks about this state where an individual can understand others' mind, and that is why it is known as theory of mind. This is very crucial for understanding children and facilitating their emotional development. Now coming to the development of self-agency. What is self-agency? All of us do operate in our natural environment, and we develop a kind of feeling that I can do it. This sense of being able to do something is called self-agency. I can talk to somebody. I can interact with somebody. I can perform this kind of activity. These are called self-agencies. It means development of instrumental behavior in the natural environment. When a person understands that things can be controlled by me, things can be manipulated by me, people can listen to me and laugh, people can listen to me and enjoy the kind of interaction that I have, then they develop as much more competent individuals. That is why this agency is important. The agency means the feeling that I can do something. Beyond this, we have to develop the transition, the skill for transition from the school to the work environment. Now, when you go to a work environment, when people move from the school to the work environment, they need a lot of skills. Parents need to facilitate, and children need to acquire these skills. For instance, in the home environment, they are highly protected. In the home environment, they are being nurtured. Sometimes they are overprotected. Parents tend to overprotect the children in the home environment. When they go out, they find it difficult to interact with the world around them. That is why it is a dual responsibility. Parents must try to, enhance independent skills of the children so that they become independent in interaction with other people. They can perform activities independently, because work environment, adolescents, we are concerned about the adolescent when they become adult, when they go to the work settings. They have to learn a lot of new skills. And they have to be taught as to how to work, how to behave in a work setting. And this has to be programmed. One can create a situation where these children can cope up with these kind of demands which they are going to experience in the outer world. Sometimes we involve other agencies to come home or to come to the school or certain places where some parents can join to help the children learn some of the pre-vocational skills. The skills which will be necessary to perform in a work situation, work setting. Some of these skills are technical skills and some of these skills are social skills. That is why there is a need for developing these skills. Because in the home setting, the parents tend to give high level of protection. Children do not develop these skills. Even the parents do not have much of idea regarding the skills which are required in a work setting. That is why we involve a lot of agencies to interact with the parents and tell them what to teach, how to teach, so that they can come out to the job setting, the pre-vocational setting to learn to perform well. This is an important issue. Now comes the issue of family resilience. The families who have children with disabilities keep on coping with the distress which they experience from handling the children. They experience distress because they do not have adequate knowledge nor skills. When we conduct parent workshops, when we try to work with the parents and try to teach them skills, they become much more skillful. When they acquire skills, when they know how to handle children, when they understand that they can handle certain problems, their stress is much lesser. This is one of the advantages of parent training programs. A number of parent training programs are conducted just to train them the skills with which they can handle the children. So the parent resilience is a very important issue, because not only that they develop coping skills like this, but also by dealing with these children, they develop it facilitates the personal growth, their well-being. They become much more interactive with other family members, and this is how their interactiveness develops. This is one of the major kind of advantage in interacting with the children with disabilities. They become much more resilient themselves. So family resilience is one of the issues. There are a number of factors which are involved in this. One is the connectedness. The family gets much more connected, much more closely knit, positive meaning of life. Many of them do have, they find out better meaning from the life. Spiritual and personal growth can also be facilitated in such situations. So these are some of the benefits from interacting with children with disabilities. Search for meaning, sense of control, maintenance of identities, and all these are important components of resilience building. You find that most of the time we find that families are not only coping, but also sometimes they are becoming problem focused. They become so much focused that they do not look into other aspects of development, and this is one which has to be much more emphasized in the family interactions. Now, in these interactions, people develop happiness, gratification, flow, and compassion. These are some of the developments that occur in families. So families are not always losers by having children with intellectual disabilities, other kind of disabilities. They benefit also having the children with disabilities. They develop some kind of resilience, and that helps them to deal with the children. There are many stresses family members come across. The stresses are because of their inability to deal with the children. The stresses may be because of the fact that they are not in a position to conduct leisure time programs for the children. They are not able to prepare their children for higher education. And one of the major problems is emerging sexuality. The child has some sexual problems, and the child is not able to express it properly. Sometimes inappropriate expression of the sexual problems brings embarrassment for the parents. Parents do not know how to handle these problems. In this case, they need the specialists, the rehabilitation professionals, to explain them how to make use of modeling, how to make use of drawings, how to make use of audiovisuals, to explain them these skills, the sexual skills, the pro-social skills, the heterosocial skills. And when parents come to know about it, they feel much better in dealing with children having this kind of difficulty, this kind of problems. There are major difficulties that by the time the child becomes an adolescent, the child's size, shape, and the strength changes. They become much more stronger. It becomes very difficult to handle them. Earlier they were handling the children in a much better way because they were small. Now when they become big, it becomes difficult for them to handle, and that becomes a major problem. But this problem can also be reduced by sitting with the child and changing the way of communication with the child. Psychotherapy has a great role to play in dealing with these children to reduce their stress, to relax them, and learn certain skills. There are some children, if you sit with them, if you talk to them, explain them carefully, they do pick up many adaptive behaviors. And these adaptive behaviors they learn and they try to translate this into action in the natural environment. They have to be explained what is private and what is personal, what is public. They have to make a description, kind of distinction between these behaviors. Certain behaviors can be private, which they can do privately. Certain behaviors which are public behaviors, and they have to be monitored while performing these behaviors. Nowadays, we used to facilitate parents to sit together to discuss about sexuality. Parent cottages are made in some of the institutions so that they can sit together, discuss together. They can create a facility for interaction in those cottages. Children of same age can interact with each other, particularly boys, girls, children with different sexes can mingle with each other, talk to each other, and this can be well monitored to understand how the child behave in certain situations. Whereas in a natural environment, child doesn't get sufficient time to interact. This kind of programmed environment can help children to learn much better because you can monitor, you can control, you can see what is going wrong in the behavior of the child. It gives a kind of experience, realistic experience to the parents to work with the children. Similar kind of laboratory settings can be created to understand how the child behaves in a social environment. Simulated environment can be created to see that the child performs well in those environments. So monitoring is very important. Reinforcing certain behaviors to sustain in natural environment has become a challenge. So reinforcer has to be given by number of family members in a very consistent manner so that the behavior can sustain in the natural environment. This is how you can sustain a behavior modification program for children with disabilities in the natural environment.
Viewers, adolescence is a period where a lot of adaptations is required, and for that adaptations, it is the duty of the community as well as the parents and all the community members to understand those adaptations which the individual is taking place. So, and there psychotherapy and other therapeutic mechanism has a role to play in this matter. So, we will continue this discussion. Before that, we will have a short break. Thank you so much. Welcome after the break. We will continue with the same topic of the psychological problems of adolescents with reference to adolescents with disability. However, this this problem, though the title is mentioning problem, but this is not a problem, rather it is a behavior which arises during the time of adolescence and which needs adaptation, as you know in the before break session. So Professor Jena will continue his talk on the same, and mainly focusing on the solution rather than problem, rather when intervention, what are the intervention which is required more in this time, so that everybody could be contributing in the development, constructive development rather we can say, for the adolescents. Thank you. Professor Jena, please.
Yes, when we try to discuss about the problems of adolescents, many of these problems come like, as I was telling you, sexuality, employment, behavior problems of number of different kinds of behavior problems, n number of problems, self-injurious behaviors, stereotyped behaviors. Some people have a lot of aggression, impulsivity, and lot many problems, sleep disturbances, you name it, a problem is there that you find with adolescent. But some problems are specific. Now, no matter how difficult is the problem, we have to understand the problem in a very systematic manner. When we look at the problems, this becomes we look at the deficits of the individual. And the deficits are so much, sometimes parents do not know what to do really, how to deal with this child suffering from having intellectual disability or some other kind of disabilities. Now, the point is that our focus should be to some extent on these problems. We need to deal with these problems as focal problems. At the same time, we have to do it in a very planned manner. When I say planned manner, we try to say that not only that the problems are important, but also there are prospects. What is that prospect? For instance, a child is grown up. He doesn't have any physical deformity, physical deficits. He can perform very well. A child with hearing impairment, with visual impairment, with impairments which doesn't affect locomotion, movement. This child can be taught many pre-vocational skills before there is a transition from the school to the natural environment to learn a job. These skills which are taught to them are known as pre-vocational skills. In the schools, we have to organize special workshops for teaching the children pre-vocational skills. When a person, all of you know, when a person earns, a lot of his problems are ignored because he's an earning member of the society, of the family. If he earns, people feel that half of the problems are gone. And when he goes to the work setting, he learns how to behave well in the work setting. And he gets very good models to work with. And these models help him to overcome a lot of problems. So not only that, we need to give training to the parents as to how to deal with the problems of, different kind of behavior problems. And the kind of teaching, the kind of parent training program which is conducted are very specific. Specific in the sense that, for instance, you are dealing with self-injurious behavior, the program will be completely different than the program which deals with sleep problems or hyperactivity or maybe reading, writing and other problems. So it depends on the kind of problem they have. But I'll tell you that there are some common elements in this. First of all, you need to find out that how long the problem persists, how many times it occurs, what are the settings where these problems are happening. We use a term called the discriminant stimulus. The discriminant stimulus or the cue stimulus which causes certain behaviors. For instance, the child gets irritated when he looks at his brother or sister because of the previous conditioning, because of the previous learning. How to reduce, you have to teach the parent that how this can be reduced, how the interaction can be made much better and reinforced. Sitting, joining for certain activities, engaging in cooperative play activities, all these activities can be organized to see that his intolerance declines. And when good behavior, pro-social behavior is emerging is developing, the child has started showing some kind of affinity, proximity, and good behavior with the sibling, this has to be highly reinforced. If you talk to the parents, you ask the parents, they will say that yes, we keep on reinforcing, we keep on rewarding, we keep on talking to the child. But the problem is that they do not follow any contingency. Contingency means the reinforcer has to be given, has to be delivered when the behavior occurs, no matter whether he sleeps well, whether he has no hyperactivity, whether he has developed very good affinity, very good social behavior towards the other siblings. The reinforcement has to be given at the moment when you see good behavior occurring. Many parents undermine this particular aspect of reinforcement. They deliver reinforcement whenever they want. Somebody has come to home, he has brought some sweets. Father has come back from his office and he has brought some chocolates. These chocolates, sweets or edibles or reinforcement is not given when it is required. They are given indiscriminately without following any schedule. When it is scheduled, when it is given, delivered scientifically, then only it will have an effect. Let me give an example. The child has performed very well today. Parent says, mother says that Papa will bring chocolate for you because today you have worked a lot sitting here and doing your homework. You have done the homework. And the father returns home about 8 o'clock in the night. By that time, the child is tired. He is about to sleep. Even if he has brought a chocolate, listening to that he has done good work today, that chocolate becomes useless for the child because he is about to sleep. So it is a reinforcement for sleep, not for good behavior. That is homework. This is what is a very typical example, very clear example of how reinforcement is misused. Sometimes children do have access to all kinds of reinforcer. The moment they demand reinforcer, something good, it is made available because he is a child with disability. जो भी मांगता है उसको दे दो. Whatever he wants, you give him. And this is a misuse of reinforcement. And if you are giving a lot of reinforcement in the family, in the home setting, other kinds of reinforcer given by a rehabilitation professional or a psychologist or a special educator may be meaningless, may not be effective. That is why it has to be controlled. Under a control situation, reinforcement works best, and this has to be outlined as to how to do. It means a program is involved in this. Behavior modification program, this is called applied behavior analysis. It is a very scientific method of giving reinforcement. Punishment, nowadays we avoid giving punishment, but we can withdraw reinforcement when wrong behaviors are exhibited. Right? For instance, parent says, I am not going to talk to you because you shouted today. You don't shout, then I'll sit with you, we'll watch a movie. So the moment the child keeps quiet, the parent sits with the child and watches a movie. The child learns how to behave and when to behave and what kind of behavior I should exhibit. This is how social learning takes place in the natural environment. And we have to be careful enough, vigilant enough to see whether you can manage the situation well. Now I was talking about the work environment. Many skills have to be taught before an individual go to the institution to work with. There are many institutions who do not know that if they take a child with disability, a person with disability, they have certain benefits. There is a need for sensitizing certain organizations, encouraging certain organizations because they are not in habit of engaging people with disabilities. Except some big organizations where they have some reservations, which many people try to get hold of, try to take advantage of. There may be an organization nearby. You can train, you can educate, and you can make the institution ready to accommodate the child so that the child can learn. You can tell them about the social benefits available. You can have visits to those organizations. You can take help of the agencies who can talk to them, and you can manage the organization that way. This is how there is a need for interaction before we leave the child, we leave the adolescent for any kind of work setting. This is very important. It is not like throwing the child to the water to swim. The child cannot swim. The child cannot work in that environment, and maybe in few days he will come back home. He may be removed because he is not able to adjust to the work environment. Many times we used to support the child to go and see how people work. Several visits are made to those organizations to see how people are working. He can work there for a very short while. Supported employment can be given. Sheltered employment can be given. You can have a sheltered workshop where the child is being taught. In the community, you can talk to people who have got children with similar difficulties and have a sheltered workshop where it can be controlled by a very seasoned rehabilitation professional or an instructor who can teach number of skills to these children so that they get ready for the job. Lack of readiness for a profession sometimes land them up in a very, very bad situation. They come back within a very short time, and we experience failure. To avoid this, maybe that we need a very programmed kind of rehabilitation program for them, kind of pre-vocational program for these children with disabilities. So programming is important, designing, planning is very important. That plan has to be done. So while doing so, you have to respond to the family needs, also try to understand the families. Sibling relationships are important. Affective involvement has to be taught so that this teaching, this kind of understanding of the sibling can help the child to develop some kind of coping skills. Many of these siblings can act as parents. We say parentified siblings. We sometimes use a term called surrogate parents. They behave almost like parents, although they are not the parents, and they support so much that even the child can manage without the parents. Think of the future of the child. When parents are no more, maybe that the siblings have to take care of the parents, of the child. And that is why this skill is very important. That is why the parents should focus a lot on developing good sibling relationship. One aspect of this relationship is called instrumental relationship. Instrumental in the sense that the siblings are trained only to look after certain needs of the individual child. For instance, the child is not able to brush his teeth, not able to wear his shoes. The sibling helps the child to learn these skills. These are instrumental skills, behavioral skills, just to teach what the child doesn't have. Developing new behaviors could be considered under instrumental skills, whereas affective involvement means how to love, how to associate, how to attach oneself with the other. Compassion, love, attachment, this can be taught by these siblings. Elder the sibling, better it is. They appear more like parents. So these are some of the issues that we have to look into. And as I told you that there are certain specific areas and there are generic areas. Most important is the autonomy, socialization, gender related issues, emotional behaviors and employment. Autonomy is important. Let them perform certain things autonomously, independently. Independent skill is very important. Socialization skills are necessary. Socialization doesn't mean just how to interact with people, but performing certain jobs. For instance, the adolescent is sent to a shop to purchase certain things. He has to exchange money. By doing this, he learns the skills regarding the skills as to how to exchange money. Not only that, how to talk to person, how to interact with an individual, but perform very crucial job which is necessary in the day-to-day life, that is exchange, how to purchase things. Similarly, if I say you go and meet that uncle who is staying in the neighborhood and ask him for this or that, how he goes, what difficulty he has, you can monitor it. Nowadays CCTVs are used. Nowadays audio-visual recordings are done to see where the child has difficulty. Whether the child has difficulty in speaking, whether the child has difficulty, has some kind of hesitation in going and approaching the individual, these are very important in day-to-day life. So you have to be there in a natural setting to learn. The interaction with when you teach these kind of skills, the interaction is not like a doctor-patient relationship. This relationship is much beyond, far beyond the doctor-patient relationship, one-to-one relationship. Here we involve the community, the family members, the people around us, even the physical environment in which the children, the adolescents operate. And improving this environment is called prosthetic environment, when this environment itself sustains the behavior. What kind of brush a child has to use in order to perform perfectly well? If you are designing a brush, you are providing a prosthetic brush to the individual. It is not only the brush, even the acceptability of the individual around the child, the love and affection which is given by the parents, the love and affection given by a neighbor, that is also to be taught. How to say good morning, right? When to say good morning to the child is also very important. The same way they have been talking, they are saying good morning may not be useful for the child. The way you are talking to a child with hearing impairment, good morning, the way you are talking to a child who has got visual impairment, and the child and the way you are speaking to a child who has got some kind of intellectual disability are different. This is not the same good morning that you use, that you convey, you reciprocate with any ordinary individual. An ordinary individual, even without hearing good morning, he can make out that you are saying good morning. If you wave your hands, they can understand that you are saying good morning or you are wishing. But children with disabilities cannot do this. I was just giving an example. Similarly, there are many other behaviors which children fail to decipher. So try to use special skills to teach them and record the way, the manner in which you have been doing it and why it is not becoming successful. There are many questions in skill training. And perhaps by working with the children, working with the caretakers and working with other people, we learn a lot from these children, like the way we learn from a book. Every child is a special child. Every child is a different child, and we have to understand that from every child we learn a lot. And perhaps the rehabilitation program will be successful if we try to be with them, right, most of the time, to understand the natural environment, create a prosthetic environment for the children to live much better. That will improve their well-being. The well-being is not just getting free from disorder or disabilities, but to adapt to the environment. But to see that how well an individual gets adjusted to the environment, and try to see that children develop, grow well, and achieve their maximum capability to reach the goals which they can achieve. This is how we can, the manner in which you can work with people with disabilities, particularly the adolescents with disabilities. Develop their self-concept, try to make them independent, and try to see that they get a job somehow. Finally, that will be the answer to many of these problems. So I hope that you have many questions. There are questions which come up. There are issues which we do not foresee sometimes. Only while working with the children we see these problems and try to fix these problems at the same environment, at the same situation. And in order to do that, we involve the parents, the family members, and around whoever is working with the child. So finally, I would like to say that the child is living in an environment, and that environment is a active environment. This active environment can be made much more interactive, much more effective by making it operationable. Operationable means responsive to the changes that is happening with the child. If positive things are happening with the child, the environment should be in a position to support it, giving reinforcement. If something wrong is happening, reinforcement could be withdrawn to see that it doesn't happen again. And these are the two groups of behavior, the desirable behavior and undesirable behaviors. And this principle can be used for n number of behaviors, large number of behaviors which are controlled by the environment, natural environment. And perhaps by doing this we are creating a prosthetic environment, we are creating an intelligent environment which is responsive for the changes that is occurring in the child. And in the entire lifespan, perhaps you have to work hard to see what is most effective for the child. This is the job of a scientist, to find out a dedicated rehabilitation professional to see how best you can sustain the positive behaviors in the natural environment. I hope you have a lot of questions, you have a lot of queries.
Professor Jain, I have a curiosity.
Yes.
Regarding you have mentioned about the reinforcement.
Yes.
So I would like to know, rather viewers also would like to know this, whether this what should be the form of reinforcement, whether it is physical form or verbal form. I think for adolescents, verbal is more important. So if you can throw some light on this.
Yes. Reinforce is anything. Reinforcer is anything which follows a behavior and increases the probability of occurrence of that behavior. So it is not necessarily that it should be sweet, it should be palatable, it should be very good, but there are few things which people do not know are acting as reinforcers. Any event, that is why it is said it is any event which follows a behavior and increases the probability of occurrence of that behavior. For some people, edibles are very good reinforcers. Young children, edibles are very reinforcers. Even there are older people who like chocolates, right? So one has to make a reinforcer menu to find out what suits whom, what the individual likes. For instance, a young child would like to read sitting on the lap of the mother. So sitting on the lap of the mother itself can be reinforcer.
Okay. Yes.
A child who is happy in sitting on a swing, that swinging itself can be an activity reinforcers. So activity, objects, edibles, anything can be reinforcer provided it increases the probability of occurrence of a behavior.
Yeah, right. Thank you. It is this is, I think, reinforcement is more related to the behavior as well as the learning, because every behavior is a learning. So, but what could be done if parents or if any person from the society, anybody from the society, who are not able to understand the changes which are taking place during the due to the adolescence period, because that is a transition period. So, if the person or the environment, we can say, is not able to recognize the changes or the behavior and considering it as a problems, so whether a sort of information is required by the to be required by the society members or parents to know about to understand about this behavior which is occurring, which is taking place in the during the adolescence, and this cannot be considered as problem.
Yes.
So if it is like that, then I think the word problem will remove from the from the stage of adolescence,
Right.
because this is very confusing whether it is problem or whether it is a new behavior which is occurring and needs stepping, some sort of stepping. So how the family members or the parents can shape those behavior? Please throw some light on this.
Now there are many behaviors which people fail to understand because they are not so conspicuous. They are not manifested well. A child is frustrated. Now he is moving around in the room. He moves around, he doesn't talk to anybody, and when you are asking, he doesn't share, he doesn't tell anything. Sometimes parents are after the child to tell what is happening. The child is not in a position to tell. Leave some time. The child may be in a position to tell you. Create a prosthetic environment where the child himself will come out and say that what is exactly is happening. But sometimes we try to see that there is a frustration, there is a distress. We need not go into details at that moment. We try to facilitate the individual to himself express the behaviors. So sometimes we assume that this is frustration and try to analyze what has happened prior to this. This is called applied behavior analysis. The antecedent, what has happened, the kind of behavior which is happening, and what it does when this kind of situation happens. So this is how we can understand the behavior, and if you try to remove one after another these elements, we can understand what exactly was causing this distress. And sometimes if the movement is much lesser, the child is much more comfortable by talking to the child, making the child comfortable, then we understand that he is free from frustration. This is how we understand, then we make analysis time and again. That is why repeated observation is very important to understand many of these complicated behaviors. What the child thinks, we cannot open his head to find out what exactly is happening. But interacting with the child number of times, observing the child number of times, we can find out what exactly goes on in his mind.
I see.
Sometimes projective drawings, this kind of activities help the child to come out with his solutions also.
Himself or herself, yes.
Yes.
So it is, yes, it is. So better to give the time, give the space
Yes.
to the concerned adolescent or concerned individual to find out the own problem, own solution of the problem by self. As you have rightly just informed about the self,
Right.
that they can recognize the self solution by
Sometimes
self.
we undermine that
Yeah.
the child cannot control.
Yeah, that is
Whereas the child is
so,
able to do that.
Yes, so understanding the child's behavior as well as at the perception of the child is more important by the society as a whole, and parents is one of the, I think, unit of the society. So as a whole, understanding of the adolescent behavior is more important.
Parents sometimes do not give that scope to
Yes.
understand that the
So-
child can control this behavior.
So giving a space to the individual is important. So all of us must recognize the child as well as the child's behavior and the child environment, and providing the space to develop, to spread itself, himself or herself. That is the adject, I think, that is the crux of the today's discussion. And I must thank Professor Jena for the beautiful deliberation on adolescents' behavior as well as the adolescents' problem, with reference to a special reference to adolescents with disability, which is a focus area of National Center for Disability Studies. I must thank you, Professor Jena, for this important deliberation. Thank you so much, and thank you, viewers. Thank you.
Thank you.
সার্থক জনম আমার জন্মেছি দেশে সার্থক জনম মাগো সার্থক জনম মাগো তোমায় ভালো বেশে সার্থক জনম আমার জন্মেছি দেশে কোন দেশেতে জানি নে ফুল গন্ধে এমন করে আকুল কোন গগনে ওঠে রে চাঁদ এমন হাসি হেসে কোন গগনে ওঠে রে চাঁদ এমন হাসি হেসে আঁখি মেলে তোমার আলো প্রথম চোখ জোড়ালো আঁখি মেলে তোমার আলো প্রথম আমার চোখ জোড়ালো এই আলোতে নয়ন রেখে মুদব নয়ন শেষে এই আলোতে নয়ন রেখে মুদব
Good afternoon, listeners. Today we will talk in detail about the Hindustani music honors under the big topic BA Performing Arts, and the course code is BAPFHMH. This program was launched in July 2021, and we have just completed 1 year this year. First of all, I'll tell you about the eligibility criteria of the students who would be able to apply in this course. The eligibility for applying in this course is 10 plus 2 or its equivalent, 10 plus 2 from any board from state or central government. And then its medium of instruction, all the learning material is in Hindi, and duration of this program is minimum 3 years as all other BA programs, but the maximum time limit for completing this program is 6 years. It is offered every year in July session only. I'll now tell you about the fee structure. The fee structure is 9,200 every year except for the first year when you register, and for registration it is a fees of 200 rupees per student. Next, I'll come to the program delivery. This program is being delivered on the web-enabled academic support system of IGNOU, that is called VYAS in short form. It means that for our program there is a separate portal where this program is, all the learning material of this program is there in the portal. Not only the learning material of theory courses, but also of the practical courses. Whatever recording of practical courses we do for you, It is actually uploaded on the YouTube, and the links are there given in the portal. And portal is a one stationed portal where you can click to different buttons and go to different components of this program, like like the learning material, that is a printed material. You will be getting the PDF form of printed material there, and the learning material of the practical component. Whatever is being taught in the BA program, everything is being recorded, and it is there uploaded in the YouTube. Not only in IGNOU's own EMPC YouTube, but also the program has its own YouTube channel also, where you can find all the tutorials and recordings, etc. The theory and practical counseling will be provided through Vyas portal from PSC 07187. PSC 07187 is actually the School of Performing and Visual Arts, which is situated in the IGNOU Maidangari headquarters. So from there we give our counseling. The faculty gives the counseling through Vyas, through online portal, through Google online meet, etc. And the assignments, etc. are also uploaded in the portal, so that you can easily find the assignments there, only pertaining to the courses of music. The other courses that are the component of the full honors program, for that you have to go to the website of your regional center, where the other subjects assignments are loaded. The links are there, and you can click and do your assignments. Particularly for music program, music core courses, all the assignments are given in the Google form, and you'll have to do it online only, and later you can submit it as and when you complete it. Apart from the regular counseling classes that is taken on the weekends, you will have to come to Delhi in the last semester. For 15 days you have to do a workshop here, and after that, after the end at the end of the workshop, your practical stage performance exam will be taken, and a project work you will have to do in a group. That project work also will be evaluated at the end of the 15 days workshop. The general objective of this program is to introduce the learner to the main themes and topics in the discipline of Hindustani classical music. This program is basically for the vocal music only. We do not teach instrumental music through this program. And then our next objective is to facilitate the learners for building ability and skills through exposure to the appropriate courses in the humanities and social sciences, to inculcate reading and writing skills in the learners through assignments and exercises, and to expose the learners to the benefits of interdisciplinary study by offering them courses other than other core discipline courses. By undergoing this program, the learner will be able to earn the proficiency to sing all the prescribed ragas with correct intonation and grammatical aspect, be able to demonstrate the prescribed talas also, be able to express their understanding of evolution of historical development of Hindustani music, and will be able to describe the gist of the treatises that were taught in through this program, and they will also gain a proficiency to collaborate with the following fellow artists and to put up a group stage show. As I told you just now, that there will be a 15 days workshop where you will have to collaborate with your fellow classmates and put up a group show which is a project work included in this program. And through this, you will be able to negotiate among the fellow artists, and you will be able to put up a program which includes some, collaborative programs. Then you will also, there are also some courses which gives you the perspective of pedagogical understanding of the subject, which will help you to get employment in the teaching jobs. Once you choose the discipline of Hindustani classical music, then you will find that there are other courses also. These are 84 credits are there for the core courses, and then you have ability enhancement courses. 84 courses means there are 14 core courses. 14 core courses may 7 core courses are pertaining to the theory component, and 7 courses are pertaining to the practical component. And then you have discipline specific electives which carries 24 credits. Then you will have ability enhancement component courses. It will have 8 credit course, 8 credits, and skill enhancements courses which will have 8 credits, and then generic elective courses which will have 24 credits. Actually, when you complete this entire program, you will complete actually 148 credits total. Except for the core courses and discipline specific courses, other courses are related to the other subjects such as environment, then English spoken, some other courses are there. Then there are many courses in the basket which you can choose and take them accordingly. The counseling of ability enhancement and skill enhancement courses and generic elective courses, you will have to depend on the regional center. You will have to daily look into the website of regional center and find out the classes they are giving you, the counseling classes they are giving you for these elective courses. For music courses, you are going to have classes through Google Meet on Saturdays or Sundays. The theory component will also be given, and the practical components will also be taken through the Google Meet platform. How do we assess your your improvement and your the way you are doing in the course? The assessment method is in IGNOU is you will be continuously assessed through the assignments, and after that on the term end examination, through the term end examination. So each course, whether it is generic elective, whether it is core course, whether it is ability enhancement, all the courses will have one assignment each on each semester. You'll have to complete the assignment first, then only you can go for filling up the examination form. After you fill up the examination form, you are ready for the term end examinations. The assignment is taken, the maximum marks for assignment is 100 marks, but the weightage is 30 marks. 30%. And in the final examination also, all the papers will be in 100 marks and the weightage will be 70%. To pass in the assignment separately and in the term end examination separately is mandatory. Term end examination for practical courses will be held online only for first to fifth semester examination. When you come to the last semester, you have to come to Delhi. As I told earlier, you have to come to Delhi, stay here for 15 days. You have to attend the 15 days workshop. The workshop will be actually based on the group project, so that you can upload you can actually do the group project and do the practices, etc. You can design your this thing project, and you can do any kind of project, like you can actually collaborate with the drama artist here, the drama students here, and you can think about some background music for their production. You can also do the background music for dance students, and that way you will know how to do the choreography. Or you can put up some choral music, and it will all these projects should include at least 5 people in 5 classmates of your class, and that way it will be a group production. So for that you need 15 days here, and you also have to give your stage performance paper in the last semester in front of audience in the performance stage. Now, I will tell you how to, apply for the program. आपको समर्थ पोर्टल में जाना है. इग्नू के मेन जो वेबसाइट है, वहाँ पर आपको समर्थ पोर्टल पे जाना है, और समर्थ पोर्टल में जाके आपको इस प्रोग्राम के बारे में सभी कुछ डिटेल में आपको वहाँ पर भी मिल जाएगा. यू हैव टू सी एंड देन you can apply there. One thing I must advise you all, that while applying for the course, please use your actual email ID, your own email ID. The person who is going to attend this program, her or his email ID should be given in the admission form, and also the mobile number you are having. Please don't give any number of your relative or your father, your brother, your mother, because after a certain time, after you take admission, it takes almost 3-4 months to actually communicate with the students. By that time, the person who has given his or her email ID will not be able to remember that IGNOU may give you some mail. And when some mail is given to you in a group, then sometimes in your mail it doesn't show, it will go straight away to the spam box, and you will not be able to watch actually what emails are coming from this School of Performing and Visual Art, or from the coordinator BAPF HMH. So, to have a proper information about your program, about your counseling classes, about the development happening, what is going to happen within 5 days or 7 days, or say about any problem you are facing regarding downloading the iCard, you are facing problem regarding the assignments, you won't be able to know, and you won't be able to also log into the portal of BAPFHMH. So please, it is very important to remember that give your own Gmail ID and your own telephone number, so that those numbers and those email IDs are attached to the BA Music portal, and it will be easy for you to log into the portal and have all the instructions from there. Whatever instructions we are sending to the students for counseling classes or for any other purpose, the instructions are given through email and group Gmail. So it will be easier to you. You will be getting all the instruction in time, and there won't be any problem regarding, even though you are doing a distance learning course, you will be able to communicate with your coordinator directly without going to the regional center. The benefit of Vyas portal is that you don't have to negotiate with the regional center. You have to go regional center because this is a BA program, and you will have other courses also, like generic elective, like ability enhancements courses, etc. For that, you need to go to the regional center. You have to give your assignments there. You have to get the electronic dump ground regarding the assignments, where you will be able to upload your assignment, and all these things the regional center will give you. But anything regarding to the music courses, you will get the instructions through Gmail, group Gmail ID, and through portal. So that's it. And I am your program coordinator, Dr. Mallika Banerjee. I am available with the contact number, email ID mallikabanerjee@ignou.ac.in, and my telephone number is also given there. You can anytime approach with any kind of problem. That's it, and have a good day.
आसाम की विशालता केवल ब्रह्मपुत्र नदी तक सीमित नहीं है, बल्कि यहाँ के सांस्कृतिक वातावरण में भी दिखाई देती है।
यही वह कामरूप है जिसकी गाथा पौराणिक कहानियों में भी पाई जाती है।
मैं कामरूप हूँ, मैं साक्षी हूँ उस पौराणिक काल का। प्रभु महादेव की करुणा से मुझ में ही कामदेव को नया जीवन मिला, इसलिए मैं कामरूप हूँ।
ऐसी ही एक पौराणिक गाथा जुड़ी है आसाम के गुवाहाटी में स्थित माँ कामाख्या देवी के मंदिर के साथ।
प्रतिदिन यहाँ हजारों की संख्या में श्रद्धालु भक्त माँ कामाख्या के दर्शनों को प्राप्त करने के लिए समस्त संसार भर से यहाँ पर आते हैं।
जिस पहाड़ी पर माँ कामाख्या का मंदिर स्थित है उसे नीलांचल पहाड़ कहते हैं। वर्तमान में मंदिर तक पहुंचने के लिए अति उत्तम मार्ग की व्यवस्था है।
परंतु एक समय ऐसा भी था जब लोगों को पत्थरों की सीढ़ियों पर चढ़कर वहां तक पहुंचना पड़ता था।
भक्ति के साथ साथ यह एक पर्यटन स्थल भी है। यहाँ के स्थानीय निवासी इसी पर्यटन से अपनी आजीविका भी चलाते हैं। हर वर्ष आषाढ़ माह में मंदिर के द्वार कुछ समय बंद रखने की परंपरा है, जिसे अम्बुवासी कहते हैं। अम्बुवासी के दौरान देश भर से लाखों भक्तजन यहाँ पर आकर रात बिताते हैं।
मंदिर खुलते ही भक्तजन माँ कामाख्या के दर्शन कर लेते हैं। अम्बुवासी प्रवृत्ति के समय यहाँ अत्यंत भव्य मेला लगता है। भक्तों की ऐसी ही भीड़ नवरात्रि में भी दिखाई देती है।
छूना है तुझे आसमां, पहुंचना है फलक तक। बहुत से मुद्दों को लेकर आज लेखन हो रहा है। साहित्य जगत में अगर हम देखते हैं तो कोई भी ऐसा मुद्दा नहीं है जिस पे आज चर्चा नहीं की जा रही है। उन्हीं मुद्दों में से एक सबसे महत्वपूर्ण मुद्दा है स्त्री की आर्थिक स्वतंत्रता। आर्थिक स्वतंत्रता, अर्थ के आधार पे कौन कौन से रिश्ते तय होते हैं, अर्थ के आधार पे कौन कौन से मूल्य तय होते हैं, और अर्थ के आधार पे जो है कैसे नारी की स्थिति आज बदली है। बदली हुई स्थितियों में आज वह अपने आप को कहाँ पाती है। क्या वह वास्तव में आर्थिक संसाधन कमाने से, आर्थिक रूप से सशक्त होने से वास्तव में स्वतंत्र हो पाई है? और ये स्वतंत्रता है क्या? आखिर नारी चाहती क्या है? समाज में उसकी क्या भूमिका है? ऐसे ही मुद्दों पर आज हम चर्चा करने वाले हैं, जिसमें साहित्य जगत से जुड़ी हुई बहुत सी रचनाओं से होते हुए मैं आपको एक ऐसे संसार में लेके चलूँगी जहाँ आप जानेंगे वास्तव में आर्थिक रूप से सशक्त होने के बाद नारी को किन किन समस्याओं का सामना करना पड़ रहा है। क्या आर्थिक रूप से सशक्त और मजबूत होने के बाद उसकी सारी समस्याओं का निवारण हो गया है, और समस्याओं के साथ साथ हम उनके समाधानों पे भी हम चर्चा करेंगे। तो आज हम बात करने वाले हैं हिंदी साहित्य के अलावा भारतीय समाज में जो नारी की स्थिति है, आर्थिक संसाधनों को लेकर आर्थिक रूप से सशक्त होने के बाद की जो स्थिति है, आज उस पर हम बात करने जा रहे हैं। अगर हम बात करते हैं आदिकाल, मध्यकाल और रीतिकाल से होते हुए आधुनिक काल तक, तो नारी की स्थितियाँ बदलती रही हैं और बदलती हुई स्थितियों में उसने अनेक उसके रूप रहे हैं। सहजोबाई, मीराबाई, अगर बात करते हैं रजिया सुल्तान की, और उसके बाद अगर हम बात कर रहे हैं आधुनिक समय में जो नारी है, कोई भी ऐसा क्षेत्र नहीं है जहाँ पर नारी ने अपनी मेहनत से जो है अपनी स्थिति को स्पष्ट नहीं कर दिया है। अपनी मेहनत से ही वो जो है आज हर क्षेत्र में अपना परचम लहरा रही है, चाहे वो पढ़ाई का क्षेत्र हो, चाहे वो इंजीनियरिंग का क्षेत्र हो, चाहे यहाँ तक कि आर्मी में भी जो है अब महिलाएं जाने लगी हैं। कोई भी ऐसा फील्ड है ही नहीं जहाँ पे महिलाएं नहीं हैं। लेकिन आर्थिक रूप से जो मूल रूप से जो अर्थ की जहाँ हम बात करते हैं कि सारे रिश्ते क्या अर्थ पे टिके होते हैं, आर्थिक स्थिति के आधार पे ही जो मनुष्य की सामाजिक स्थिति निर्धारित की जाती है। ऐसे ही जब हम बात करते हैं किसी भी नौकरी पेशा महिला की, अगर बात करते नौकरी पेशा की, तो क्या जो डॉक्टर है, इंजीनियर हैं, प्रोफेसर्स हैं, वही जो है महिलाएं आत्मनिर्भर है? नहीं। कोई भी छोटा मोटा जो काम है, चाहे वो दुकान चलाना हो, चाहे कपड़े की दुकान करना हो, हर काम जो है महिला जो है जो कर रही है, जिसके ऊपर काफ़ी पहले की एक चर्चा चली कि जो घर में जो रहती है, क्या वह महिला कोई काम नहीं करती है? क्या उसके श्रम का पैसा नहीं दिया जाना चाहिए? महिला के श्रम का कोई क्या पैसा देगा? वह तो वास्तव में घर को घर बनाती है, वह तो वास्तव में जीवन की धुरी है। क्या उसकी जो मेहनत है, क्या हम उसका मूल्य उसे चुका सकते हैं? चुकाया ही नहीं जा सकता है। एक माँ से का जो है ऋण कोई कैसे उतार सकता है? बहुत से अगर हम वर्तमान की जो आत्मनिर्भर जो महिलाओं की बात करते हैं, तो हम देखते हैं आत्मनिर्भरता में जो पैसा महिला कमाती है, क्या वास्तव में उसके ऊपर उसका हक है? क्या वह अपनी मर्जी से उसे खर्च कर पाती है? क्या वह जो चाहे उसको उस तरीके से उससे जो चाहे मकान बनाना हो, चाहे प्रॉपर्टी लेनी हो, क्या वो खरीद सकती है? तो सवाल आता है, शायद नहीं खरीद सकती है। उसे सलाह की ज़रूरत होती है। किसकी सलाह की? यानी कि सलाह कौन देगा? जो उससे अपने आप को सर्वश्रेष्ठ समझेगा। जरूरी नहीं है वह सलाह किसी पुरुष की ही हो, वह सलाह उससे पितृसत्तात्मक मानसिकता से वशीभूत किसी स्त्री की भी हो सकती है। यहाँ पे हमारा जो मेन जो मुद्दा है आज, जो आर्थिक स्वतंत्रता, प्रभा कितान क्या लिखती है 1999 में? औरत की स्वतंत्रता उसके पर्स में निहित है। वह एक अपनी उम्र से 18 साल, 15 साल, 18 साल से भी ज़्यादा या 15 साल से भी ज़्यादा बड़े पुरुष के साथ वो जो है अपनी मर्जी से वो रहती है, और वो सशक्त जो है वो बिजनेसमैन है। अपना एक फिगरेट वो चलाती है, और उसके बाद जो है उसकी बड़ी कलकत्ता में उसके बहुत बड़े कारखाने हैं, बहुत से नौकर चाकर उसके यहाँ काम करते हैं। वह लाखों की बजाय करोड़ों में कमाती है। उसके बावजूद भी उसके पैसे का हिसाब किताब डॉक्टर साहब रखते हैं। लिखती है वो अपनी आत्मकथा में कि डॉक्टर साहब जो हैं वो जिस प्रकार से बिल भरना, टैक्स भरना, उसी प्रकार से जो है वो है क्या करते हैं, जो भी वो पैसा आता है उसका हिसाब किताब भी वही रखते हैं। कौन देता है? दे तो आप खुद रहे हो, लेकिन आज जो है सवाल उठ रहे हैं। दे रहे हो उसके बाद जो है, क्योंकि आप उनसे भावनात्मक रूप से जुड़े हुए हो, आपने उनको अपना सर्वस्व मान लिया है, और जब मान लिया है और उसके बाद दे रहे हो और देने में तकलीफ हो रही है, इसी के बीच का द्वंद्व का नाम है समस्याएं जो हैं, जिस पे आज मूल रूप से हम चर्चा कर रहे हैं, वो यही हैं। हम दे रहे हैं। क्या लिखती सुशीला टागभोरे अपनी आत्मकथा में कि मैं जो है प्रोफेसर है वो, और उसके बाद जैसे कॉलेज में जाती हैं तो बैंक का नाम लिखा उन्होंने कि बैंक में जो है वो सैलरी लाने के लिए मेरे पति जाते हैं। जो महिला पढ़ा रही है, प्रोफेसर है, उसे ये नहीं पता कि सैलरी कैसे ली जाती है, लेकिन वो लिखती हैं इस चीज़ को कि मैं जो है, मेरे पति मुझे ये बात कहते हैं, मैं ऐसा डर, ऐसा उसके दिमाग में जो है ऐसे डर उसके में बैठा हुआ है कि वो ले ही नहीं पाती है। आज भी अगर हम देखते हैं, अगर हम बात करते हैं, तो क्या हम देखते हैं? हम देखते हैं साफ साफ कि जो खाना खाने के बाद थाली फेंकने का रिवाज, कोई महिलाएं थालियाँ नहीं फेंकती हैं। बताती हैं वो कि पास जैसे गुजरती है तो आहिस्ता से मेरे पति मुझे बोल देते, पानी देना, और उसके बाद जैसे मैं सुनती नहीं तो कहते कि बहरी हो गई हो, तुमने जानबूझ करके मुझे प्यासा मारोगी। और उसके बाद जब वो कहती है कि मैंने तो सुना नहीं, तो वो क्या क्या उनको जो है बदतमीजी भरी गालियाँ देते हैं। लिख रही है वो इस चीज़ को कि बीएड करने के बावजूद, पढ़ी लिखी होने के बावजूद, वो जो है घर की आर्थिक स्थिति के लिए, क्या है, आर्थिक स्थिति के लिए हॉस्पिटल में उनको चद्दर बदलने का काम दिया जाता है कि तुम्हारी यही औकात है। वो लिखा है उन्होंने। जो शिकंजे के दर्द में सुशीला टागभोरे लिखती हैं कि मुझे बार बार ये महसूस कराया जाता है कि तुम कुछ नहीं हो, तुम एकदम से जीरो हो, तुम जो है कुछ कर नहीं सकती हो। ये नहीं है कि तुम्हें नौकरी मिल गई तो तुम बहुत बड़ी तोप हो गई हो, कुछ नहीं हो तुम। और ये जो भावना है, मैं इससे लड़ती, और लड़ते लड़ते जब मैं बोलती तो मुझे क्या है, बदले में क्या मिलता? मुझे बदले में मिलती, लिखा है उन्होंने शिकंजे के दर्द में, कि इतनी ज़बरदस्त मेरी पिटाई होती। ये समाज का एक ऐसा यथार्थ है, जो आत्मनिर्भर महिलाओं का एक ऐसा सच है, जो महिलाएं लिख रही हैं। किसमें? किसी कहानी और उपन्यास में नहीं। कहानी उपन्यास में तो हम कल्पना का समावेश भी कर सकते हैं, लेकिन उन्होंने ये बात रखी है अपनी आत्मकथा शिकंजे के दर्द में। और जब प्रभा खेतान, जो उनसे पता चल जाता है डॉक्टर साहब को कि वो उनके बिना रह ही नहीं सकती है। कौन सी भावुकता है ये महिलाओं की, जिसके कारण वो उसे मुक्त ही नहीं होना चाहती हैं, छोड़ना ही नहीं चाहती हैं उस भावुकता को कि पुरुष के बिना तो हमारा काम चल ही नहीं सकता है। क्योंकि ये परंपराएं जो बनी हुई हैं, उसमें एक छोटे बच्चे से जब वो पैदा होता है, उसको सिखाया जाता है कि उसका सर्वे सर्वा कौन है, उसे इसी माहौल में उसे रहना है, और इसी माहौल में रहते हुए उसे अपना विकास करना है। और कब ये बात घर कर जाती है, एक महिला पढ़ी लिखी आत्मनिर्भर महिला के मन में ये जो है बात घर कर जाती है कि वह जो फैसले लेती है, उससे ज़्यादा मजबूत फैसले जो हैं वो पुरुष के होते हैं। और इसी भाव के चलते जो है, वो जो भी कमाती है वो किसको देती है? वो अपने परिवार को देती है। 55 खंबे लाल दीवारें, अगर इस उपन्यास की अगर हम बात करते हैं तो उसके खुद माता पिता नहीं चाहते हैं। आज हमारे समाज में ऐसी लड़कियों की जो है एक पूरा एक ऐसा वर्ग है जो आत्मनिर्भर होने के बाद जो है शादी नहीं करता है। पहले क्या कहा जाता है कि तुम्हारे जो है जिस ओहदे पर तुम हो, उसके बराबर के ओहदे वाला कोई लड़का नहीं मिल रहा है, हम कैसे शादी करते हैं ऐसे किसी के साथ भी। और उसके चलते लड़कियों की उम्र चली जाती है। आज भी हमें समाज में अपने इर्द गिर्द अगर हम देखते हैं तो यह एक मूल समस्या के रूप में हमारे सामने है। 55 खंबे लाल दीवारें की कोई काल्पनिक कहानी नहीं है। आज ऐसी जो लड़कियां हमारे आसपास हमें मिल जाएंगी जो आत्मनिर्भर होने के बावजूद भी जो है शादी नहीं करती हैं। एक समय में जो है भाई अपनी बेटी के लिए लड़का ढूंढ रहा है और बहन की उसे चिंता नहीं है कि अब तुम क्या शादी करोगे, अब इस उम्र के बाद तुम्हें शादी की क्या ज़रूरत रह गई। क्या लिखती हैं प्रभा खेतान? जो प्रभा खेतान कहती है अन्या से अनन्या में, वो लिखती हैं कि लूली लंगड़ी या फिर जो है तलाकशुदाओं तक की शादी हो जाती है, तो मुझे शादी करनी है, डॉक्टर साहब मैं शादी करूँगी। अब तो कह रहे कि तुम क्या कमी है तुम्हें, तुम आराम से रह रही हो, तुम्हें शादी की क्या ज़रूरत है, और कोई भी मिलेगा तो वो तुम्हारे अतीत तुम्हारे साथ जुड़ा रहेगा। यानी कि वहाँ पे एक पैसे दिखाया है प्रभा खेतान ने कि पैसे के प्रति जो है किस प्रकार की ललक है। अगर आप आत्मनिर्भर हो, अगर आप अच्छा पैसा कमा रहे हो, दूसरा एक सवाल उठता है तो फिर जो है पुरुष जब कमाता है तो वो परिवार के लिए कमाता है, और जब महिला कमा रही है तो वो किसके लिए कमा रही है? क्या वो परिवार के लिए नहीं कमा रही है? यहाँ पे भी दो तरह की चीज़ें हमारे समाज में देखने को मिलती हैं, जिस मानसिकता की मैं यहाँ पे चर्चा करने वाली हूँ। आज भी हमारा समाज पितृसत्तात्मक समाज है। पितृसत्तात्मक समाज के चलते क्या है, पुरुष को ये कहा जाता है कि वास्तव में जो है घर चलाने की जिम्मेवारी उसी की है। और वास्तव में जो है अगर हम देखते हैं इस चीज़ को, अगर हम स्पष्ट रूप से हम देखते हैं तो अगर पद्मा सचदेव क्या लिखती हैं, पद्मा सचदेव जो है वह लिख रही है अपनी बोंद बावड़ी में। बोंद बावड़ी में उन्होंने लिखा है कि वो रेडियो पर काम करने के लिए जाती हैं। रेडियो पर जब काम करने के लिए जाती हैं तो वहाँ पे वो जैसे ही वहाँ से वापस आती हैं तो जिस दीप नामक लड़के से उसने शादी की थी, प्रेम विवाह किया था, तो वो क्या है, उनको जो है एक समय के बाद जो है वो साफ साफ बोलते हैं, अपने पड़ोस वालों से जाके वो बोल रहे हैं कि मुझे जो है 5 या 7 रुपए दीजिए। लोग बोलते क्या हो गया भाई? बोले मेरी बीवी नौकरी करने के लिए जाती है और मुझे गम गलत करना है, वो पता नहीं किस किस से मिलती है। ये एक ऐसा मुद्दा है आत्मनिर्भर महिलाओं की, जो नौकरी पेशा महिलाएं हैं या जो भी काम करती हैं, सबसे ज़्यादा जो मुद्दा जो बनाया जाता है वह मुद्दा है चरित्र का। चरित्र में आप किसी मध्यम वर्गीय जो पति है उसकी एक ऐसी मानसिकता निकल के सामने आती है। पद्मा सचदेव ने जो बोंद बावड़ी में लिखा है कि एक ऐसी मानसिकता निकल कर सामने आ रही है कि वो ये तो चाहता है कि जो है पत्नियां या महिलाएं या बेटियां काम करें, नौकरी करें, ताकि आर्थिक रूप से परिवार सशक्त हो सके। आर्थिक रूप से उन्हें सहयोग तो चाहिए, लेकिन ये भी होना चाहिए कि वो किसी पर पुरुष से बात ना करें। पर पुरुष से बात करने का सीधा मतलब जो है वो जिस चीज़ से जोड़ा जाता है वह उसका पूरा वजूद होता है। और जब ऐसी सिचुएशन में, ऐसी परिस्थितियों में जब कोई इंसान काम करता है तो उसके लिए काम करना बहुत ज़्यादा मुश्किल हो जाता है। हम स्वतंत्रता में कौन सी साहित्य में जो महिलाएं लिख रही हैं वो कोई किलोल कल्पनाएं नहीं लिख रही हैं, वो जो समाज में घटित हो रहा है वही वो लिख रही हैं। इसमें ये मुद्दे निकल के सामने आते हैं कि वास्तव में जो है ये जो सारी समस्याएं जिनकी हम चर्चा कर रहे हैं, ये जो समस्याएं अब चल रही हैं, क्या इन समस्याओं का कोई समाधान है? क्या हमें इसके समाधान पे हमें चर्चा नहीं करनी चाहिए? बिल्कुल करनी चाहिए। और समाधान ऐसा तो कुछ होता ही नहीं है। जो समस्या अगर जन्म लेती है तो उसका समाधान उसके साथ में उत्पन्न होता है। आज पहले अगर हम बात करते हैं तो अगर जो लोगों की जो मानसिकता बदली है, प्राचीन काल में बेटियों को नहीं पढ़ाया जाता था, लेकिन आज पढ़ाया जाता है। चाहे वह किसी बड़े ओहदे के अधिकारी की बेटी हो, चाहे किसी झुग्गी झोपड़ी में काम करने वाले का बच्चा हो, फुटपाथ पे रहने वाले का बच्चा हो। आज ये कोई नहीं सोचता है कि मैं अपने बच्चे को नहीं पढ़ाऊं। पहले बेटियों को पढ़ाया जाता था ताकि उनको अच्छा घर मिले, अच्छा उनको वर मिले, लेकिन आज बेटियों को पढ़ाया जाता है कि वो किसी अच्छे ओहदे पर जाएं। जब वो मानसिकता बदली है तो ये मानसिकता भी बदलेगी। लेकिन समस्या नई है तो समाधान भी नए ही होंगे। समस्याएं जो है प्राचीन काल वाली समस्याएं आज नहीं है तो समाधान वो नहीं चलेंगे। परंपरागत ढांचे में में हमने जन्म लिया है, जिसमें पले बड़े हैं और जो जिन्हें हम संस्कार मानते हैं, जिन्हें हम परंपराएं मानते हैं, उनको जब हमने अपने हिसाब से अपनाया है तो चीज़ों को में यहाँ भी बदलाव की संभावना स्वाभाविक है। अगर हम बात करते हैं जो प्रभा खेतान के अलावा जो कृष्णा अग्निहोत्री है, कृष्णा अग्निहोत्री ने लिखा है कि वो जो है पति जो है वो नौकरी करने के लिए जाती हैं। उनके पति की जो है अपनी ही आदतों के कारण, स्पष्ट उन्होंने लिखा है, लगता नहीं है दिल मेरा में, कि किस प्रकार से अपनी आदतों के कारण IAS अधिकारी होते हैं, लेकिन बाद में जो है अपनी आदतों के कारण उनकी नौकरी छूट जाती है। जब वो भी जो हैं वो प्रोफेसर हैं, नौकरी करती हैं, टीचर हैं, और जब वो नौकरी करने के लिए जाती हैं और जब वापस आती हैं तो वही किसी पुरुष का नाम लेकर उनको जो है परेशान किया जाता है। वह सोचती हैं कि क्या मतलब लिखा है उन्होंने कि एक जो औरत है जो वो काम पे निकलती है और एक पुरुष जो काम पे निकलता है उसमें ज़मीन आसमान का फ़र्क है। एक औरत जब काम पे निकलती है तो वो पूरा घर लेके निकलती है, वो पूरा परिवार लेके निकलती है, और जब वो घर जाती है तो देखिए किसी भी कामकाजी महिला को आप देख लीजिए, जाती है तो उसके हाथ में बैग होता है, उसमें कई किसी में सब्जी है, किसी में कुछ है, किसी में कुछ है, और जैसे टूटती हुई घर के अंदर जैसे घुसती है, जब वो गेट खोलती है और अंदर जाती है तो उसके साथ में पूरा घर का सामान जाता है। घर वो दिमाग लगाती है कि क्या क्या रह गया है, क्या क्या काम जब वो करती है उस समय भी उसे उसके दिमाग में ये चलता है कि जो है मुझे क्या क्या घर लेकर जाना है, मेरे घर में क्या है क्या नहीं है, किस तरह की चीज़ें हैं। ये लिखा है मनु भंडारी ने। मनु भंडारी लिखती हैं कि एक कहानी ये है भी में कि मैं ये सोचती रहती कि जो है गृहस्थी की जो क्या पूरी जिम्मेवारी मैं ढोती रहूं, क्या मैं ही अपनी गृहस्थी को, या क्या मेरी अकेले की जिम्मेवारी है, क्या राजेंद्र जी का कोई फर्ज नहीं बनता है। साफ साफ वो लिखती हैं कि एक बार क्या है कि कोई उनकी लेखिका महिला जो है आई हुई हैं और बेटी बीमार है, और बेटी बीमार है तो वो कहती हैं कि आप जो है गुड़िया को देखना है, तो वो कहते हैं कि नहीं नहीं, झूठ बोल के राजेंद्र जी गए हैं। वो कहती है कि झूठ तो उन्होंने मुझे सदा से बोला है। और इस तरह जो है किस प्रकार की वो दिखता नहीं है, लेकिन मानसिक रूप से जो है वो आर्थिक रूप से अगर महिला सशक्त है और उसका पति अगर जो है इस मानसिक नौकरी पेशा नहीं है और इस मानसिकता को लिए हुए है कि ये महिला जो है कमा भले ही रही है लेकिन मुझसे नीचे है। क्या लिखती हैं मनु भंडारी कि करवा चौथ पर इतने बड़े लेखक जिन्होंने महिला स्वतंत्रता का बिगुल बजाया, वो मेरे लिए क्या है, मेरे लिए जो है वो कैसे पति हैं। वो लिखती हैं कि करवा चौथ पे वो कहीं ना कहीं मैंने कभी करवा चौथ नहीं रखा, एक रखा तो कहते हैं कि जब मैं झुकी उनके पैरों में तो वो जो है उन्होंने सर पे हाथ रखा, आशीर्वाद दिया, लेकिन कहा कि मैं ये सब पसंद नहीं करता, यानी कि अंदर से वो चीज़ें पसंद हैं। एक महिला जब चलती है, वो देखती है तो वो उसको भांप जाती है कि उसमें उसके घर में किसे क्या पसंद है, कैसे उसे रहना है, किस तरह के उसको कपड़े पहनने हैं, किस तरह उसे लोगों से व्यवहार करना है, बाहर उसे किस तरह से लोगों से उसे बात करनी पड़ेगी। अगर वो काम जिस भी फील्ड में वो गई है, चाहे वो हॉस्पिटल्स में डॉक्टर हो, चाहे वो आर्मी में हो, चाहे वो कॉलेजेस में हो, कहीं पर भी वो अपनी मर्यादा का पूरा ध्यान रखती है। जब एक महिला को जो है उसके साथ साथ अगर वो किसी से बात करती है तो जो समाज में जो सबसे बड़ा जिसे कहा जाता है, जो चर्चे किए जाते हैं, क्या कह रही है मनु भंडारी, ये लगता नहीं कि सॉरी क्या नाम है इसका, कस्तूरी कुंडल बसे की लेखिका मैत्री पुष्पा कहती है कि जब एक महिला काम करने वाली, जो आत्मनिर्भर महिला जब घर से निकलती है वो बड़ी शानदार लगती है। और हम वहाँ पे जो निठल्लियाँ, उसे सिर्फ और सिर्फ घर परिवार, माता पिता, रिश्तेदारों के ही अपमान का सामना नहीं करना पड़ता है, उसे सामना करना पड़ता है उन अनजान महिलाओं का भी जो उसे जानती तक नहीं है, और फिर भी जो है एक नौकरी पेशा महिला से उनके मन में एक ऐसी नफरत, या नफरत नहीं कहेंगे उसे हम, ईर्ष्या, जिसे शब्दों में नहीं बांधा जा सकता है। और वो जो है लिखा है मैत्री पुष्पा ने अपनी आत्मकथा में कि जो महिलाएं काम निठल्ली डॉक्टरनियाँ, यानी कि पति डॉक्टर हैं, तो वो जो है पति जाने के बाद वो लोन में बैठ जाती हैं, जो घरेलू महिलाएं हैं, और वो आती जाती हुई महिलाओं पे जो टीका टिप्पणियाँ करती हैं कि इनके बच्चों को कैसे नौकरों के पास रहना पड़ता है इससे अफेयर चल रहा है, वो उससे हंस के बात कर रही थी, और उससे ये चीज़ें जो निकल कर जो सामने आती हैं, कहती कि इससे हमें ये नहीं था, हमें कोई लेना देना नहीं था। स्पष्ट रूप से उन्होंने स्वीकार किया, हमें कोई लेना देना नहीं था, लेकिन हमें एक जो है संतुष्टि मिलती थी कि हम ऐसी महिलाओं की बुराइयां कर रही हैं, और जो हम कर नहीं सकते तो हम क्या करते हैं, जब हम बराबरी नहीं करते हैं तो हम आलोचना करते हैं। यानी कि यहाँ पे साहित्य में बताया है महिलाओं ने कि जो कामकाजी जो महिलाएं हैं, वो आर्थिक रूप से भले ही वो स्वतंत्र जो पैसे कमा रही हैं, लेकिन जो संपत्ति या जो समाज में जिन समस्याओं का अभी मैंने जिक्र किया है, वो उन सभी समस्याओं का सामना कर रही हैं, उसके बावजूद भी वो क्या है, चल रही हैं। और इसके अगर समय के हिसाब से जब जो समाधान हमने सुझाए हैं कि हर जो समस्या के हिसाब से जो समाधान निकला है, पहले बेटियों को पढ़ाया नहीं जाता था, पढ़ाया जा रहा है। हर जो आज बच्चे से, आज ज़रूरी नहीं है कि अगर हम देखते हैं कि अगर बेटा बेटी के प्रति जो धारणा है वो लोगों की बदली है, ऐसा नहीं है कि आज पुत्र का होना अब उतना ज़रूरी रह गया है जितना वर्षों पहले था। तो समाज में बदलाव हुआ है। इसी बदलाव में अगर मैं बात करती हूँ चंद्रकिरण सोनरेखा की, तो चंद्रकिरण सोनरेखा ने लिखा है कि जब वो काम से एक पत्रकार को, वो जो है संपादक को वो पत्र लिखती हैं, लेखिका हैं, तो उनके पति जो हैं वो कहते हैं कि तो ये पत्रकार भी गाली देते हैं, गाली देते हुए बोलते हैं, जिसका मैं प्रयोग नहीं कर सकती हूँ, लेकिन उन्होंने गाली दी। क्या बोले गाली देते हुए कि ये पत्रकार भी फला जो भी बोले, उसके बाद बोलते हैं कि ये ऐसे होते हैं, लड़कियां का अगर लिखते तो तुरंत जवाब देते हैं, और अगर कोई पुरुष लेखक लिखने लग जाए तो जवाब तक नहीं आता है। यानी दिखाया है, यानी पुरुषों ने अपने अपनी वक्तव्यों के जो बोल रहे हैं उसी के माध्यम से उन्होंने दिखाया है कि उनकी मानसिकता क्या है। प्रभा खेतान जो बोलती है डॉक्टर साहब से कि डॉक्टर साहब मैं कहाँ जाऊँगी, मेरा जो आपसे संबंध बन गया है, अब तो मैं, अगर मेरी माँ को पता चलेगा, जो भी है वो प्रेग्नेंट हो जाती हैं और बोलती हैं कि मैं अब क्या करूँ इसका, तो कहते हैं कि ये हमारे प्यार की निशानी है। तो प्रभा खेतान बोलती हैं कि ये कोई प्यार व्यार की निशानी नहीं है, ये जो तीसरी जो चीज़ उठी है जो कि ये एक देह का आकर्षण था, ज़बरदस्त आकर्षण जिसे हम प्रेम कह रहे हैं, वो था, और उसके चलते ये हुआ। तो अब मुझे क्या करना है, मैं नहीं चाहती हूँ ये बच्चा। तो डॉक्टर साहब कहते तुम अमेरिका चली जाओ। अन्या से अनन्या में उन्होंने लिखा है कि डॉक्टर साहब बोलते हैं तुम वहाँ पे ये बच्चा तुम जो है इसे पैदा कर लेना, और जो है उसके बाद हम इसका जी मेरा वो रहेगा, इससे मैं यहाँ खुलम खुलाते से नाम नहीं दे सकता हूँ। यानी कि आप आत्मनिर्भर हो, आप जो है विवेकशील हो, उसके बाद आप समाज को क्या दे रहे हो, कौन सी, हम जो है अगर हम बात कर रहे हैं साहित्यकारों में इन, अगर जिन महिलाओं की मैंने चर्चा की है, तो क्या हम प्रभा खेतान को एक आदर्श मान सकते हैं? हम समाज को दे क्या रहे हैं? आत्मनिर्भर स्त्री जो है वो दे क्या रही है समाज को? एक अर्थ कमा के, क्या वो जो है सशक्त युवा पीढ़ी की स्थापना कर रही है, या जो संतान उसकी है उसे वो कौन से मूल्य दे रही है? क्या ऐसे मूल्य दे रही है कि अगर मुझे स्वतंत्रता, जब मेरे पास पैसा है, आज़ादी मुझे मिल गई, और जो है उसके बाद जो है दोस्त भी मुझे मिल गए, शादी नहीं की उन्होंने, शादी नहीं करने के बावजूद भी जो है वो न उन्हें पहनने की दिक्कत है, न खाने की दिक्कत है, न रहने की दिक्कत है, प्रेमी भी पास है, जैसे तैसे करके उनके पास आ ही जाता है और वो उसे मना ही लेती हैं। तो क्या हम समाज को जो है, ये कौन सी चीज़ हम समाज के सामने परोस रहे हैं? ये कहानी प्रभा खेतान की कहानी नहीं है। ऐसे बहुत से मुद्दे हमें समाज में देखने को मिलते हैं। ऐसी बहुत सी जो है लड़कियां हमें देखने को मिलती हैं। अकेली प्रभा खेतान ने तो लिख दिया है, लेकिन हर कोई लिख नहीं सकता है, हर कोई बता नहीं सकता है, लेकिन समस्या है। और इस समस्या से क्या समाधान निकल के सामने आता है कि अगर हम इस तरीके से करते हैं तो उसका रिजल्ट ये निकलता है, आप सशक्त हो, आत्मनिर्भर हो, मजबूत हो, अच्छा है, आप मौका मिला है, हमें इसको रचनात्मक करना है, हमें इस चीज़ को कैसे आगे लेके जाना है, इसी के माध्यम से जो है हमें कैसे एक सशक्त देश का निर्माण करना है, कैसी सशक्त जो है पीढ़ियाँ बनानी है। हम नए हैं, जमाना नया है, संस्कार भी तो नए देने पड़ेंगे, ऐसे संस्कार जो विकास की तरफ लेके जाएं, ऐसे मूल्यों को हमें गढ़ना होगा जो एक नई दिशा समाज को दे सके। इसी तरह की जो है आत्मकथा लिखी है चंद्रकिरण सोनरेखा ने। बच्चों के लिए मैंने जो है नौकरियां की, बच्चों के लिए मैंने पति को भी सहा, लेकिन ये नहीं है कि मैंने उसे नहीं कहा, सिर्फ मैंने सहा नहीं, मैंने कहा भी जब मुझे सही लगा। भले ही मुझे ऐसे मौके आए कि मुझे मन किया कि मैं इसको छोड़ के चली जाऊं, लेकिन नहीं, छोड़ के जाना कौन सा हल है। लिखती हैं वो जो है अपने पिंजरे की मैना में। पिंजरा हम किसे मानते हैं? क्या घर हमारा पिंजरा है? क्या बच्चे हमारा पिंजरा है? क्या परिवार हमारा पिंजरा है? नहीं, वो इस चीज़ को पिंजरे के साथ वो उड़ जाती हैं कि समस्या जो है, जो भी समस्या आती है उसको हम सकारात्मक दृष्टिकोण से हम उसका कैसे उसका हम समाधान कर सकते हैं। ये चंद्रकिरण सोनरेखा की आत्मकथा में हमें स्पष्ट रूप से देखने को मिलता है। अगर हम बात करते हैं प्रभा खेतान की, और उसके अलावा एक आत्मकथाकार हुई, उन्होंने लिखा हादसे, रमणिका गुप्ता। मैंने अपनी मर्जी से अपना जीवन जिया और मैं जो है उन्मुक्त रही। मैं किसी भी पुरुष ने मेरा शोषण नहीं किया, किसी भी जो पुरुष है उसने मेरी मर्जी के खिलाफ मुझे किसी ने हाथ तक नहीं लगाया। ये लिखती हैं, यानी कि आप सशक्त हो, मजबूत हो, लेकिन आपकी मर्जी से जो हुआ वो मर्जी से हुआ। तो क्या ये होना ही सबसे महत्वपूर्ण है? क्या स्त्री देह मात्र है? क्या स्त्री का जो है एक ही रूप है और उसी रूप पे हमें लिखे जाना है, उसी रूप में हमें गढ़े जाना है, उसी रूप पे हमें चर्चा करनी है, उसके अलावा कुछ है ही नहीं? ये सारे मुद्दे जो हैं, ये मुद्दे हैं आधुनिक आत्मनिर्भर स्त्री के। और ये इन मुद्दों को जो है बहुत ज्वलंत तरीके से साहित्य में भी उठाया जा रहा है, कहानियों में भी उठाया जा रहा है। ऐसा कोई क्षेत्र है ही नहीं जहाँ महिलाएं बोल नहीं रही हैं, जहाँ महिलाएं कह नहीं रही हैं। आज उनमें जो है ये आत्मनिर्भरता के बाद जो है, जो मुद्दा मैंने रखा है, ये आत्मनिर्भरता के बाद ही रखा है। यानी कि समस्याएं जो हैं ऐसी भी नहीं है कि कोई समाधान इनका नहीं होगा, लेकिन ऐसा भी नहीं है कि लोग जो है इस चीज़ को वो दबा दिया जाएगा। अगर वो कमाती है तो उसका भी हक है, वो अपने हिसाब से खर्च कर सके, अपने हिसाब से प्रॉपर्टी बना सके। क्या लिखा है सुशीला टागभोरे ने, मैं जो है इतना संघर्ष करना पड़ा मुझे अपनी ही कमाई का घर खरीदते हुए अपने नाम कराने में। यानी कि उनके पति चाहते ही नहीं थे। महिलाओं के नाम से कौन से घर खरीदे गए हैं? महिलाओं के नाम से क्या हुआ है जो तुम अपना घर खरीदने चली हो? लेकिन वो अड़ जाती हैं और लड़ती हैं। उन्होंने लिखा है इसे अपनी आत्मकथा शिकंजे के दर्द में। वो लिखा है कि लेकिन मैं पीछे नहीं हटी, भले ही मुझे मार खानी पड़ी, मुझे गालियां सहन करनी पड़ी, लेकिन मैं पीछे नहीं हटी। और नहीं हटने का ही परिणाम है कि जो है मैंने अपना घर अपने पैसे का घर जो है वो अपने नाम से खरीदा। और आत्मनिर्भर जो महिलाएं हैं वो भले ही उनको जो है हर इंसान को हम, और हर पुरुष को या फिर हर परिवार को हम एक जैसा नहीं कह सकते हैं। ऐसे जो है हर पिता, हर पति और हर जो है बेटा भी एक जैसा नहीं होता है। समय के हिसाब से चीज़ें बदली हैं और महिला कथाकार लगाइए या फिर महिला उपन्यासकार लगाइए, महिला कहानीकार लगाइए, महिला जो कविताएं हैं उनमें वो अपनी अभिव्यक्तियां कर रही हैं, अपनी फीलिंग्स को, अपनी भावनाओं को अभिव्यक्त कर रही हैं। ये भी एक प्रकार की आज़ादी है। आत्मनिर्भरता मनुष्य को मजबूती देती है और हर बेटी को आत्मनिर्भर होना ही चाहिए। हमें अपनी बेटियों को ये सिखाना भी चाहिए कि किस प्रकार से हमें जो है अपना साम्राज्य खुद स्थापित करना चाहिए। अगर आप सिखा रहे हो कि जो है हमें ये होना चाहिए, वो होना चाहिए, उसके साथ साथ ये भी होना चाहिए कि हाँ जो है लिंग भेद की जो नीति है, जो लिंग के आधार पे हम एक ही पुरुष, यानी कि ये काम है तो ये पुरुष करेगा, ये काम है तो ये महिला करेगी, हमें इन चीज़ों को जो है छोड़ना होगा। और आत्मनिर्भरता की तरफ जो एक नई पहल हमारे समाज में काफ़ी समय से हो चुकी है और हर लड़की, जहाँ पे हर लड़की जोश के साथ आज सिर्फ एक ही सपना देखती है कि वो आत्मनिर्भर बने। हर पिता चाहता है कि उसकी बेटी आत्मनिर्भर बने। और इसी का जो है, इसी के साथ साथ जो है मैं एक नई बात अगर मैं कहूँ तो ये होगी कि बुलंदियाँ हैं बहुत, हमें छूना है। बुलंदियाँ हैं बहुत, हमें छूना है। आप अभी तो क्या है, थोड़ी सी जमी को नापा है, अभी तो पूरे आसमान को छूना है बेटियों के लिए। और हर सशक्त और आत्मनिर्भर महिला के लिए यही है कि वो जो है एक सकारात्मक तरीके से अपनी चीज़ों को आगे बढ़ाए और साहित्य सृजन में जो लेखिकाएं हैं और जो है अपनी अभिव्यक्तियां जो दे रही हैं और अपनी बात को रखने का जो हक उनको है उसको और आगे बढ़ाएं। यही मेरा वक्तव्य है।